Hello and welcome to the State of Montana Benefit Plan Coverage and Enrollment Presentation for New Legislators. My name is Melanie Denning from the Healthcare and Benefits Division, HCBD, and the purpose of today's webinar is to educate you regarding the State of Montana Benefit Plan. The state plan coverages available to you as a new legislator are important, and this is to educate you on how to enroll in state plan benefits once you get sworn into service in January. Let's get started. If you have any questions after the presentation, please contact the Healthcare and Benefits Division, HCBD, at 800-287-8266 or by emailing benefitsquestions@mt.gov. The state plan is a self-funded health plan. It is funded by monthly employer, employee, legislator, and retiree contributions. The contributions are held by the state plan and used to pay state plan expenses, the vast majority of which are claims for services incurred by our members for their medical, prescription, and dental needs. When you balance our income with our expenses, you get the state plan reserve. State of Montana Benefit Plan, or state plan, is self-funded. And the funds that pay for the plan member expenses and benefits come from two places. The first is that employer contribution, which is a per month contribution paid by the state of Montana on behalf of each employee. This amount is set by the legislature and funded by income from state taxes. The other place the money comes from is you, the plan member. Your monthly benefit contributions are calculated based on who you enroll on your plan and which optional benefits you elect. When you go to the doctor, dentist, or fill a prescription medication, that bill is sent to one of our third-party administrators, or TPAs. The state plan contracts with these TPAs to process and pay the claims based on the benefit design of the state plan. And again, the state plan reserves are the remaining funds that offset for unexpected costs the state may be responsible for in the future. State plan reserves are needed because we can't control all the variables surrounding and operating the state plan. We can control many of our plan costs, but there are some things we simply don't have direct control over, including our largest income source, the employer contribution. That employer contribution is set by the legislature every 2 years, and HCBD provides funding recommendations, but ultimately we must comply with the funding recommendations set by the legislature. The employer contribution hasn't changed in 4 years and is not expected to change in 2021. HCBD works hard to evaluate expenses, so we have a general idea of the volume of claims each year, but there can certainly be surprises. Medical trend, increasing costs of medical care are both huge variables that the state plan does not have little control over. It's difficult to predict. The cost of medical procedures and prescription medications continue to rise year over year. The state plan always needs to have enough money available in the reserves to cover all 30,000 plus members when they need us. The Healthcare and Benefits Division always strives to implement innovative solutions to address the ever-rising costs of healthcare. Solutions such as reference-based pricing, partnerships with best-in-class vendors such as Navitas Healthcare Solutions, and the implementation of new value-based programs like medication therapy management and remote blood pressure programs. These ensure that the state can continually maintain state plan benefits and contributions. Our strategies have been successful in allowing state plan to control costs effectively, also manage the plan and improve health outcomes for our member. HCBD continues its efforts to control costs and manage the state plan, continuing to work with Montana hospitals and other partners to address the rising costs of healthcare on behalf of our state plan members and taxpayers at the state of Montana. The state of Montana contracts with TPAs, or third-party administrators and vendors, to process and pay claims based on benefit designs and coverages of the state plan, as well as offer fully insured benefits such as life insurance, the Employee Assistance Program, and others. This slide outlines the various third-party administrators and the vendors we work with at HCBD to manage our state plan for the benefits of the employees, legislators, and retirees. In the coming slides, we'll highlight some of the state plan benefits and coverages available to you as a new legislator. As a new legislator, you can elect state plan benefits effective the date you are sworn into service. The benefits you elect from are very similar to the benefits available to state of Montana employees. If you elect state plan benefits, you're enrolled in core benefits. Core benefits provide for legislator-only coverage for medical and prescription drug coverage, vision coverage, and one annual eye exam, dental, and basic life insurance. In addition, if you elect state plan coverage, you will have optional benefit choices as well. You have the option to add a spouse or domestic partner and or a dependent child or children under the age of 26 to medical and dental. You have the option of electing coverage for vision hardware for yourself and your dependents. Please be aware that if you enroll a spouse or domestic partner and or dependent child or children, you'll be required to provide documentation upon enrollment that verifies their eligibility as your qualified dependent. You're also eligible to enroll in extra life insurance. If you already have health insurance coverage and you do not wish to enroll in state plan benefits, you do have the option to opt out or waive state plan coverage. If a legislator opts out or waives state plan coverage, the legislator is available to receive an eligible reimbursement up to $1,054 a month for premiums paid by the legislator in conjunction with the employer group health plan or premiums paid for other certain types of disability and life insurance. The state plan is restricted by federal regulation from providing reimbursement for Medicare, Medicare supplements, Medicare Advantage, and individual coverage through an insurance carrier or health insurance marketplace premiums. If you want to opt out or waive state plan coverage and receive the option 2 reimbursement, you can complete the legislator opt-out waiver form at www.benefits.mt.gov/forms. Reimbursement of any kind is not available if the legislator enrolls in the state plan. You can call HCBD at 800-287-8266 for additional information and discuss this option. Before we review state plan benefits, you need to be aware that the state plan does not provide coverage for workplace injury or illness. This means you cannot use the state plan, including Montana Health Centers, for any work-related injury or illness. If you or anyone covered on the state plan, including your dependents, gets hurt or sick while working, the state plan won't provide coverage, even if you have a work comp waiver. You will want to be sure that you and your covered dependents have the proper insurance coverages in place to cover work-related injuries. For example, if you or a covered dependent own a small business or a working farm or ranch that earns a profit, and you're injured while working, you can't submit claims to the state plan and cannot use the Montana Health Centers to treat the illness or injury. As a state plan member, you and your covered spouse or domestic partner and or child or children will receive medical benefits as defined by the state plan. State plan medical benefits are administered by Allegiance. Listing on this slide is a summary of the copays, deductibles, benefit percentage amounts, and the maximum out-of-pocket associated with the medical plan when you receive services from a participating provider or facility. All deductibles and maximums will be based on the plan year, which is January 1st through December 31st. If you use a non-participating provider or facility in Montana, these same cost-sharing amounts will apply. However, the state plan will pay a fair rate for your care, but if you use a non-participating provider, they may balance bill you for more. Please know that you are responsible for this balance bill and it doesn't count toward your deductible or your maximum out-of-pocket. If you use an out-of-state, non-participating provider or facility, the cost sharing is shown in this table. Remember, these amounts are separate from the deductible, benefit percentage, and the maximum out-of-pocket for participating providers and facilities, as well as non-PAR providers and facilities in Montana. Additional information regarding medical plans, including the WRAP plan document, can be found on our website at www.benefits.mt.gov. Legislators and covered dependents over the age of 2 who are covered by the state plan can't use any of the Montana health centers. There are health centers in Anaconda, Billings, Butte, Helena, and Missoula. Non-Medicare eligible retirees and their non-Medicare eligible dependents can also use the health center for services. Our Medicare eligible retirees and their Medicare eligible dependents can only use the health centers for health screenings and for flu shots. Montana health centers are so much more than urgent care. Remember, you can make a Montana health center doctor your primary care provider. They provide the same services that a regular doctor's office provides. And if you already have a primary care doctor, you can still use the Montana Health Center at no cost for your physicals, health screenings, lab work, vaccines, and more. So call and ask the Montana Health Center if you have any questions about what kind of services are available to you. The Montana Health Centers are operated by a company called Care Here. The state plan pays 100% of the costs associated with the plan care that you receive at a Montana Health Center, which means anything you get at a Montana Health Center is paid in full by the state plan. You don't ever see a bill. However, please do be aware that if services received outside the health center apply to regular state plan benefits, even if a provider at the health center referred you. Navitus Health Solutions is the state plan's pharmacy benefit manager for prescription drug plan. With Navitus, you have a retail network pharmacy 34-day option for filling your medications, and you also have a retail network or a mail order 90-day option. For specialty medications, Lumicera is the preferred specialty pharmacy. You will want to visit www.navitus.com to get all the information you need regarding the state plan's participating network of pharmacies. Also, you'll want to review the formulary, the listing of covered medications, and the tier in which they are covered. Here's a look at the prescription drug plan copay structure. Notice that if you're on a maintenance medication or a medication that you take every single day, you will save money by using that 90-day option because you get 3 months of medication for just 2 copays. There are $0 preventive products, Tier 1 preferred generics that are $15 for a 34-day supply and $30 for 90. Tier 2, and you can see that copay for a 34-day supply is $50. Double that and you get 3 months supply for $100. Tier 3 are non-preferred products that do have alternatives available in Tier 1 and Tier 2. The coinsurance you pay on Tier 3 doesn't apply to the per individual out-of-pocket. And Tier 4 are specialty drugs provided by Lumicera. They are at a $200 copay. And if you get your specialty medications outside of the Lumicera pharmacy from a retail network or out-of-network pharmacy, you will be charged a 50% coinsurance, which does not apply to your maximum out-of-pocket. The prescription drug plan has a separate maximum out-of-pocket than the medical plan, and that is an $1,800 individual max or $3,600 per family. Tier 3 and Tier 4 coinsurance amounts, remember, don't apply towards this max out-of-pocket. The maximum out-of-pocket will be based on a plan year of January 1 through December 31. As previously mentioned, you can get a 3-month supply of medication at your local retail pharmacy or a mail-order pharmacy. The maintenance medications are things that treat chronic long-term conditions like diabetes, high blood pressure, asthma, or others. Schedule 2 or Schedule 3 prescription medications, which are narcotics, are still limited to a 34-day supply. To get started, you just request your prescriber write your prescription for the 90-day supply. You receive the 90-day or 3-month supply and only pay 2 co-payments. Most participating in-network pharmacies can dispense the 90-day supply, but you may also get a 90-day supply through a state plan mail order vendor such as Costco, MyRx Pharmacy, or Ridgeway Mail Order Pharmacy. Let's talk Delta Dental. This is our dental third-party administrator that processes the state plan's dental claims. This slide shows the reimbursement amounts set by the state for plan services. The state plan pays an annual maximum of $1,800 per enrollee per calendar year. The dental plan applies a $50 deductible per enrollee, or $150 per family per plan year to basic and major benefits. Please remember, diagnostic and preventive benefits are not subject to the deductible. Delta Dental provides members with 3 network options: preferred, premier, and non-network dentists. Choosing a preferred dentist results in you, the member, paying the least. You can also refer to the new member benefits book or the HCBD website for more information on the dental plan. Regarding vision benefits, every member covered on the medical plan does receive 1 routine vision exam per year for $10 copay. If you elect the optional benefit of vision hardware, this benefit is elected at the time you enroll in state benefits. If you elect the vision hardware plan, anyone that you have, a dependent or spouse, domestic partner, or child or children that you cover on the medical plan, will also be enrolled in the vision hardware plan. And the vision hardware plan provides some protection and reimbursement for frames, lenses, contacts, and specific add-on features for your glasses. Regarding participating providers, before you receive any provider, facility, dental, or vision services, it's always a good idea to double check that your provider is participating with the plan. Visit our website at www.benefits.mt.gov and click on the service you're seeking, such as medical, dental, etc., to either check that they are on their website or you may call. The slide reflects an example of the Allegiance medical provider search capability of their participating providers. This slide shows the monthly costs that you will be responsible for if you choose to elect state plan coverage for medical, dental, vision hardware benefits for yourself and any dependents you wish to enroll. Remember, the employer contribution amount is $1,054 per employee per month. As a new legislator, you'll be given the opportunity to participate in the Live Life Well incentive program and earn an incentive towards your monthly benefit contribution for the 2021 plan year. Please pay close attention to the upcoming slides for more information on how to participate and earn the incentive for 2021. As a reminder, if you elect state plan coverage, you'll be enrolled in the Basic Life Plan, which is a $14,000 life insurance coverage on yourself. You'll be also given the opportunity to elect additional life insurance coverage when you enroll in state plan. This slide reflects the life insurance rates for any additional coverages that you choose to elect. Effective January 1st, 2021, the state plan is implementing a tobacco surcharge for the plan. This affects any member who uses nicotine. The surcharge will add $30 to the monthly contribution amount for those employees or legislators who use nicotine, and an additional $30 per month if the employees or legislators' covered spouse or domestic partner uses nicotine. When you complete your state plan elections, you will be required to indicate if you are nicotine-free or a nicotine user, and definitions of both are on this slide. Nicotine is the addictive substance or stimulant proven to have negative health effects found in cigarettes, cigars, chewing tobacco, and most vaping products. You are considered nicotine-free if you have never used nicotine, you have quit using nicotine, or you infrequently use, such as less than 4 times a month. You are also nicotine-free if you're currently using nicotine, but you have gone through and completed an eligible alternative provided, such as nicotine cessation programs or a nicotine counseling session with a medical provider in the last 12 months. The definition of a nicotine user is if you are currently using nicotine and have not completed an offered eligible alternative, such as nicotine cessation or nicotine counseling session with a provider in the last 12 months. During the election process, if you indicate that you're a nicotine user, the surcharge will apply and a $30 amount will be added to your monthly contribution. Then an additional $30 per month will be added if you indicate that your spouse or domestic partner uses nicotine as well. Paying for state plan coverage. During the legislative session, your state plan contributions will be withheld from your biweekly paycheck. The medical, dental, and vision contributions are withheld on a pre-tax basis. After the session, you will be billed monthly via ACH. Additional information regarding the billing process and ACH withholding will be provided at the session end. As previously mentioned, newly elected legislators who intend to enroll in state plan coverage for 2021 will have a special opportunity to earn the Live Life Well incentive for 2021. The deadline for all three activities is December 31st, 2020. The required activities will be covered on the next slide. Completing these required Live Life Well activities and completing all self-reporting requirements will allow you to receive the Live Life Well incentive toward your 2021 contribution, so don't miss out. Please reference the new Legislator Live Life Well incentive packet found on HCBD's website at www.benefits.mt.gov/new-legislator. You can also contact the HCBD Wellness Manager, Kim Pullman, at 406-444-3809 for more information. Only those legislators who are going to enroll on state plan benefits should complete the required activities. To earn the incentive for 2021, the new legislator must complete a state plan health screening with Care Here, self-report that they're nicotine-free or complete a nicotine-free alternative, and self-report an eligible next step activity. New legislators interested in earning the Live Life Well incentive for 2021 will contact the HCBD Wellness Manager, Kim Pullman. Kim will work with you to schedule an appointment for a state-sponsored health screening and with Care Here and answer any questions you may have regarding the incentive program. Remember, Kim's phone number is 406-444-3809. To earn the incentive for 2021, new legislators must complete these activities in total. If you are interested in earning the incentive, you must also complete and return the Live Life Well incentive new legislator form. This form is included in the new legislator Live Life Well incentive packet found on the HCBD website at benefits.mt.gov/new-legislator. Remember, to earn the incentive, these activities must be completed by a new legislator by December 31st, 2020. Switching gears to the 2021 Live Life Well incentive program, for new legislators who elect state plan coverage, the 2021 incentive period to complete activities and earn an incentive for January 2022 will begin on January 4th, 2021. So when state plan coverage begins, you wish to earn the 2021 incentive, please pay close attention to the next slide. To earn the incentive for 2022, new legislators must complete a state-sponsored health screening with Care Here, self-report their nicotine-free or complete an alternative, and self-report a completion of a provider visit. What is an eligible provider visit? It is an annual physical examination with a medical provider, which is an appointment where you and your doctor have a complete physical examination based on your age, gender, and other factors. The examination should include a discussion of your health screening results, so bring them along so your doctor can review the results with you during the appointment. If you have a medication that you take daily, your doctor may renew the prescription, and if you need referrals to other services such as behavioral health, physical therapy, or others, this can happen at that provider visit as well. You may choose any kind of medical doctor that best fits your needs. Any kind of medical doctor is acceptable, from a family practitioner to a specialist, depending on who is most appropriate for you. Nurse practitioners, physicians and assistants are also eligible providers. Keep in mind that regular benefits apply to that visit, and any additional services beyond the provider's time may incur extra expenses. But if you do attend a provider visit at a health center, the out-of-pocket costs don't apply to those visits. If there is a reason you cannot perform any of the Live Life Well activities, please contact Healthcare and Benefits to learn more. And this applies to both the 2020 and the 2021 Live Life Well incentive programs. Here's a list of Live Life Well contacts for our incentive program. Please note, for new legislators, you'll not have access to the Active Health website until January 2021. That is when you will be enrolling in state plan benefits. New legislators participating in the new Legislator Incentive Program will have access to only health centers for health screenings and flu shots until they officially join the state plan. Once you have joined the state plan in January 2021, you'll have full access to the health centers. And last is the information for contacting our benefits division for any questions. In order to take full advantage of the state plan benefits, you'll need to enroll in benefits by February 4th, 2021. Your coverage will be effective January 4th, 2021. After January 4th, 2021, you'll be able to go to benefits.mt.gov to begin your enrollment. You will receive additional instructions from Healthcare and Benefits as your enrollment time gets closer. To clarify, there is nothing you need to do now. You will be notified to enroll after January 4th, 2021. If you do not enroll in benefits during the initial enrollment period, you automatically waive coverage. As a legislator, you can enroll in core benefits after February 4th, and your effective date will be the first of the month following the date you enroll. But you will then miss out on enrolling any optional benefits such as your dependents on medical, dental, or vision hardware, life insurance, dependent life insurance, long-term disability, and flexible spending. If you do not, by February 4th, 2021, you will only be able to add dependents to your state plan benefit if you qualify for a special enrollment period or during open enrollment period, which is annually for 2 weeks every fall. You can go to www.benefits.mt.gov to enroll. To get started with your new legislator enrollment, please visit www.benefits.mt.gov and click on New Benefit Enrollment green button. You'll log in by entering your username and password. But since you're a first-time user and accessing the system outside the Montana network, state of Montana network, you will go through the registration process of setting up a username, a password, and answering security questions. Our company key is State of Montana, all lowercase, no spaces. Once you've completed your registration and accepted the terms in the system, you'll be led to the home page that contains the Start Here button. Clicking on Start Here allows you to begin your enrollment and prompts you to enroll in your benefits or to waive coverage. You must make your elections by the deadline shown on the calendar or it will be waived. You may also enroll in your benefits using your mobile application by downloading it on your mobile device. The application is the My Choice mobile app. In order to sync that mobile application with our benefits enrollment system, you do need an access code that you have to gain on our homepage of our enrollment system. You may also enroll in benefits using the application downloaded on your device. In order to sync them up, remember, you will need the passcode from our website. www.benefits.mt.gov is a great resource for you to find out what you need to know as a legislator. The website is where you'll enroll in benefits, make changes during open enrollment, update your personal information, report your wellness activities, and just overall stay on top of all things benefits related. To find the 2021 contribution on our website, just click on the Resources drop-down menu and 2021. More information regarding the tobacco surcharge can also be found on the same Resources drop-down menu. Just click on Tobacco Surcharge. Here are some ways you can make the most of your state plan benefits. Doing these things saves you money and the state plan money. Use participating providers and in-network pharmacies. Visit the HCBD website for links to participating providers and in-network pharmacy directories. Review your medications. Some medications qualify for the 90-day fill at retail or mail order. And remember, when you fill, it's 2 copays for 3 months of medication. Use the Montana Health Center whenever you can for no-cost services and take advantage of our wellness programs. Finally, please be aware that some of our vendors may contact you with cost-saving informative programs for you to participate in. It is completely optional participation on your part. If you're looking for more information on your benefits, please feel free to contact the Healthcare and Benefits Division staff with any questions or concerns at 800-287-8266 or email us at benefitsquestions@mt.gov. Please be sure to keep an eye out for state plan information that's mailed to your home address and emailed to you at a preferred email address. Thank you for attending.